I'd like to call the Onslow County Board of Commissioners meeting to order for Monday, May 5th, 2025. At this time, we ask the County Attorney, Mr. Brett DeSalms, to lead us in the invocation.
Let us pray. Dear Heavenly Father, we thank you for this opportunity to come before you and conduct the business of Onslow County. Lord, be with the commissioners today in their deliberations and bless them with wisdom and guidance as they address the items on today's agenda. We pray for the men and women in our armed forces who serve our country with tremendous courage, commitment, and sacrifice. May all we do this day bring you honor and glory, and we will continue to thank you and praise you for the blessings you have bestowed upon us. Amen. Now, with deep respect and reverence for the faiths, beliefs, and traditions of those gathered here tonight, hear us in a moment of silence. Thank you.
Please stand for the Pledge of Allegiance. I pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
I'd remind everyone to please set your cell phones to vibrate or silent. I'd like to recognize the elected officials with us this morning. Mayor Pete Perrin from Holly Ridge, Register of Deeds, Ms. Amika Jarman, Town Alderman North Topsail Beach, Rick Grant, and Sheriff Onslow County, Sheriff Chris Thomas. So we thank everyone for being here this morning, and we will move right into the adoption of the agenda. Need a motion?
Motion to approve the agenda.
Second.
Motion and a second. Any discussion? Hearing none, all in favor signify by saying aye.
Aye.
Those opposed? Hearing none, motion carries. Now, we need approval of the items on the consent agenda. If there's one someone would like to have pulled off and discussed separately, now's the time to do that. If not, I need a motion for the approval. Have a motion and a second. Any discussion? Hearing none, all in favor signify by saying aye.
Aye.
Those opposed? Hearing none, motion carries. So we'll move right into item 3, presentations. And I do believe our health director, Ms. Kristen Hoover, will do that this morning.
Good morning, Chairman, Vice Chairman, and Commissioners. This morning I'm bringing to you a presentation of the 2024 Onslow County Community Health Needs Assessment. This is a community health needs assessment that we do every 3 years. The purpose of it is to assess our community health issues, to prioritize these issues, and to equip our decision makers with information that they need to make informed public health decisions. The point of it is to identify any health gaps, to develop programs to bridge those gaps, and to push forth any items that would require policy change to improve the outcomes. We do this to meet general statutes, to meet our accreditation requirements, and in partnership with the hospital to meet RRS requirements of the hospital. This is a community health assessment that is done in partnership with our hospital. The health department is required to do this every 4 years, the hospital every 3, so therefore we fall to the hospital's cycle and do this every 3 years. The methodology that we follow is that this is a 2-part assessment. We collect data that is already available, that is published by others. This is typically data that centers around what our population looks like, what disease trends we see, and a lot of social determinants of health. And in addition to that, we collect information, our primary data, from our citizens here in Onslow County. To collect this data, we conducted 6 focus groups, and we also had a web-based survey. There were a little over 1,100 responses to this survey, and we promoted this all throughout 2024 with advertising in the mall in conjunction with our community partners. And then the focus groups that we conducted focused on different population areas. So we had a focus group that focused on senior citizens' needs, a focus group for youth needs, and then also on limited English proficient populations. One of the main questions that we ask is, what is the main health problem that affects you and your family in our community? And this is the responses that we received from that question. The number is a little bit off because every question that was in this assessment was optional. And so you see just a few people skipped this question, but largely what they identified were these social determinants of health, these mental behavioral health issues around anxiety, depression, substance use. And then following right behind that were a lot that deal with chronic disease and behaviors that can lead to chronic diseases. Out of this, we identified 2 key health priorities, one being chronic disease prevention. This focuses on that physical health, diet and exercise, and doing everything that we can to prevent chronic disease development. And then second, behavioral health, that mental health and substance use issues also focuses on things like tobacco cessation and preventing children from beginning use of vaping or other products. So whenever we were looking at the chronic disease prevention, some of the concerns that we found, this is primarily in that secondary data review, data that we reviewed that is published by others, is that our community has a high prevalence of diabetes, hypertension, obesity, and heart disease. Some of the barriers that were identified in our community were the limited access to healthy foods and available exercise opportunities. Medications have high cost and we lack some specialty care locally. And then, because chronic disease can be very burdensome to manage, it is compounded with stress and mental health that makes chronic disease management more difficult. In the mental health and substance use arena, some of the concerns that we identified in the data published about our community is that we have high rates of deaths of despair. This includes suicides, overdoses, alcohol-related causes, and you can see in the charts that are here that Onslow County is higher than both North Carolina and the United States in both of these areas, and that we have high rates of alcohol and tobacco use. We also know that our population is very heavily saturated with active duty and veterans. We know that in these populations, we see higher rates of mental health disorders and also higher rates of suicide that often occur with substance use disorder. Some of the barriers that we had to do with access to mental health services and cost. People feel like there is stigma around accessing mental health services, and they have a lack of awareness. One of the questions that we asked, you see shown here in this chart, why did you not get mental health services if you felt like you needed them? And largely it was around cost, no coverage, or they just did not know how to access that mental health system. So the next steps is that this study was conducted in 2024. We have written this document up. It is a lengthy document. We have submitted it to the Division of Public Health. Now we move towards creating community health improvement plans that we call CHIPs that will show what we will do about these issues. Now that we know that these are the focus areas, what should we do about it? We will track the progress using a scorecard and develop annual state of the county health reports that we will bring to our Board of Health for review each year. We're partnering with our hospital and with other stakeholders in how we will implement these CHIPs. Next year, we will deliver a State of the County health report and give you updates on the CHIPs, and then the next comprehensive community health needs assessment will occur in 2027. So just to give you an idea of what kind of work is being done in the 2 areas that we have identified, for chronic disease prevention, the health department delivers a diabetes prevention program. We also do Healthy for Life, which focuses on nutrition and lifestyle habits. Faithful Families is an opportunity for us to partner with our local faith community to develop healthier living. We also try to raise awareness around preventive health services and getting early diagnosis and treatment for diseases that can be managed if they are found early. And then offer a variety of nutrition, physical disease, and chronic disease prevention programs. For mental health, one of the new programs that we have just recently launched is Question, Persuade, Refer, or QPR. This is to recognize the signs of suicidal ideation and try to prevent that. The Strategic Opioid Advanced Response is a group of stakeholders that meets regularly to review and try to prevent substance use in Onslow County. Overdose Fatality Review is built patterned after the Child Fatality Review Committee. The point of this is to look to see where there are systems issues or were there points in the process of identifying or offering someone help that could have prevented or led to a different outcome for those individuals. We also provide a variety of substance use prevention programs. Catch My Breath is one that we have been able to do with the public school system, and it is targeted to reduce vaping or to stop those who have made the choice to vape. Operation Med Drops and the safe disposal of medication is something that we do, and partner with the city-owned. They have a drop box right there in the public safety building. We distribute Narcan and provide education on how to administer Narcan. We also provide education around adverse childhood experiences and try to show that the experiences that children have early in life can have lifelong impacts on their health. And then again, we collaborate with other agencies to try to ensure that citizens are aware and know how to use the health system that exists here in our community. If you want any other information about these programs, you can always reach out to our community relations team. They would love to come to speak to any civic organization or community group to try to raise awareness around these health priorities in our community. There was no action that was requested, but I appreciate the opportunity to deliver this presentation to you this morning. If you have questions, I'm happy to try to answer those.
Questions?
I just want to make a statement, and I've had the privilege of working with you, Ms. Christine, since I believe 2018, and I just want to say thank you. I know we don't always agree, but I love how you handle every disagreement fact-based and where your job requires you to do, and thank you for your work and your preparation and what you do to support our community. I think you do a fantastic job with our health department, so thank you.
All right, thank you.
And I would echo what he says as well. Thank you so much. I am curious, is this something that Kevin and his team work to get out more of this kind of like how to promote participation within the community?
Absolutely. Our community relations officer works closely with
Okay.
Kevin and with that team,
Wonderful.
so they're always in partnership with us. We have posted the draft document that is on our website. We're kind of holding back on promoting it out too widely. We're waiting to see if the Division of Public Health had any comments or
Gotcha.
any revisions that they would like, but this is something that will be out there for years to come until our next cycle in 2027. And so, yes, ma'am, we are working closely with Kevin and his team on that.
Good. Thanks.
Any further comments, questions? Thank you, Ms. Hoover.
thank
Job
you.
well done. We appreciate it. We asked all those in attendance to make sure, again, to make the cell phones are on silent or vibrate. We offer one opportunity for public comment. Those comments should be limited to no more than 5 minutes and may be on any issue upon which the Board of Commissioners has control. In accordance with the board's adopted rules of procedure, commissioners shall reserve responses, if any, for the commissioner comment period on the agenda. So we'll move right to public comment. Mr. Smitherman, do we have anyone signed up for public comment?
Yes, sir, Mr. Chairman, we sure do. The first speaker is William Spencer.
Good morning. Thank you for the opportunity to speak with you this morning. First of all, I want to thank you for your service to Onslow County. I get it that it's not the, I served on Richlands Town Board for two years, so I kind of understand it's a thankless job sometimes. I'm a resident of 105 Brand Street in the city limits of Richlands. To give you a point of reference of where that is located, Rand Street is at the intersection of 258 on the west side of town. And according to DOT traffic count, we now have about 24,000 cars that come through there every day. So, why am I here? This is not something that I really enjoy doing, but I'm here because we are having a problem in Onslow County, especially people that live close to highways, with the noise that is coming from what I call illegal vehicles that are traversing our highways. And most of y'all probably know what I'm talking about. You probably travel the same roads that I do and maybe startled the same way that I am sometimes. I sent an email to the chairman, and he was good enough and responded and told me that there were some ordinances being reviewed that perhaps would speak to this issue. I think part of the problem is, it really isn't an ordinance issue as much as it is an enforcement issue of North Carolina general statutes. For those that may not be aware, the general statute, effective January 1st, 2023, North Carolina General Statute, titled Exhaust Systems and Emission Control Devices, it says, no person shall drive a motor vehicle on a highway unless such motor vehicle is equipped with a muffler or other exhaust system of the type installed at the time of manufacture. Well, my guess is that these vehicles that we see with these mufflers that are about this big are not installed at the time of manufacture. That's just an uneducated guess. It goes on and says, it shall be unlawful to use a muffler cutout on any motor vehicle upon a highway. And it goes on. And I want to reiterate to you, it doesn't say anything about noise. So I am here about noise because it does impact me. But it talks about how the vehicles are being modified and how that is illegal. So again, why am I here? I was in the infantry for 28 years. And I know a couple of y'all, at least a couple of y'all here have served in the military. I overcame issues. On the night of April 13th, my neighbor cranked his truck, and I dove for cover. It's that loud. I shouldn't live that way. Now, I've talked to law enforcement at Richlands, and they tell me that pretty much their hands are tied because if they take a case to district court, the judge throws it out and says, whatever he says, I don't know, but they say law enforcement can't process them because judges throw out the cases. As a citizen of Onslow County, what I'm here to do is just start the conversation of how this can be fixed, because it is impacting more people than just me. It is impacting people that drive up and down the highway. I mean, you do it, you drive, I keep honeybees over on Comfort Highway in Richlands, one of the things that I do. And I can hear them coming for 45 seconds or a minute before they even pass my property. That's how loud this is. This needs to be fixed. And I realize that, y'all are not law enforcement, but I'm asking you to leverage your just leverage what you can do for us. I see my time has expired, but thank you.
Mr. Spence. Yes, sir. Thank you.
Mr. Chairman, the next speaker is Charlie Fretwell.
Good morning, Mr. Chairman, Vice Chairman, and Commissioners. Thank you for the opportunity to speak. This is going to be a little rough, given I just spent a week in California dealing with some family issues, and I got to sleep in the Atlanta airport last night due to weather, so not a lot of sleep here. All right, so I'm here to talk about the shooting range off of 172. Mr. Taylor Green has brought it to your all's attention. Vicki Fretwell, my sister, has also been here multiple times to sort of bring this to your all's attention. One of the things that I noticed, though, when Taylor Green was here was that I'm not entirely sure he's described the geographic area in which all of this has taken place. So I'm going to describe that geographic area, discuss some of its impacts, and then provide some recommendations to county attorneys, commissioners, and others with regards to how we rectify this issue. In terms of the geographic location in question, right, all of this property is bordered by 17 on the west, Pilchard's Branch Road on the north and east, and 172 to its south. All of that encompasses the property that I'm discussing. I'm going to neck it down a little bit further, right? The specific property in question is to the east of Stones Creek and to the west of Pilchard's Branch Road and 172 where it intersects. So we're talking about a much smaller confined area. And those of you familiar with the area, I think that kind of gives you an idea of where this location is at. Confined in that space, east of Stones Creek and west of the Pilchard's Branch Road 172 intersection, is land that's being used as a shooting range, approximately 47 acres total, all of which adjoins or butts up against Pilchard's Branch Road, and then on its south side, it butts up against the Fretwell property. The Fretwells own purchased property out there, roughly 2001 time frame, and there's about 25 acres or so that run from 172 up to the south side of this shooting range that is in question. Brief description of the range. The shooting range, and again, south side of shooting range adjoins, it butts up against the north side of the Fretwell property. There are firing positions that are approximately, they're within 100 feet or less of the property line. There are multiple hard structured firing positions within 100 feet or less of the property line. They are shooting at targets that run to the southwest. They border our property to the southwest and to the southeast. So they're firing due north of our property. They're shooting at targets that run southeast and southwest, approximately 100 feet, yet again, of our property line. There's no consideration. I understand that there's some former military folks up here. There is no consideration for the safety danger zones associated with firing those weapon systems. I have 25 years in the Marine Corps. I'm a former tanker. I'm an enlisted tanker that converted to the dark side, commissioned back in 1999 timeframe, and spent my entire career in tanks. I know an awful lot about firing of weapon systems, safety danger zones, things of that nature. There is zero consideration. I have had bullets, spent bullets, actually whiz through my property with no impact or idea where those bullets are coming from, up until about 3 weeks ago where I discovered where this range is at. Other issues, right? The noise we've already talked about, I'm not going to address it other than this. I have taken decibel readings of this firing range that exceed 80 decibels from 700 feet and in when these people are shooting, right? That's dangerous, right? That's dangerous to hearing. My nieces and nephews need to leave the property in order to not suffer from the ear damage. They go south to their grandmother's house so that they can get out of this noise. Additionally, we have as nearly as I can tell, there's zero consideration for the impacts this firing range has on the watershed out there. Again, they're east of Stones Creek. The water moves from west to east towards the game reserves. These people are shooting thousands of rounds a day, and they shoot 7 days a week. No exaggeration, thousands of rounds on Saturday and Sunday. They're exceeding anywhere from 2,000 to as much as 4,500 to 5,000 rounds a day. That's an awful lot of lead that's being left on that watershed out there. And that water moves from east to west. It is going to leach into the water supply, negatively affecting residential areas out there, and also negatively affecting the water that moves into that game reserve. Hey, the one thing I want to direct you to, given that I'm running out of time, is that there is an article written by a Mr. Brand, Robert Brand, NC State Extension, in which it clearly states one of the takeaways is that you county commissioners, you county attorneys, and others actually have a leg to stand on when it comes to shutting this thing down, regardless of the farm ordinances or farm zoning that he was recognized for having. All right, and I'll share that with the sheriff when I leave.
Thank you,
for
sir.
your time.
Yes, sir. Thank you. Thank you, Mr. Fretwell. Mr. Smithman?
Thank you, sir. Just a couple things for this afternoon for your interest as well as the public's. We are getting close to balancing a budget. I'll say that it is a more constrained operational budget due to slower growth in our revenues, particularly in sales tax. We are preparing for a slower economy over the next 12 months. We've enjoyed a very robust growth over the past 3 or 4 years, and we expect that to have plateaued. So it'll be a little more difficult. Operations will be a little tighter, but we do feel good about continuing with full investment into the Commissioner's strategic plan and capital plan. I want to congratulate both our professional and volunteer firefighters for the 3 days or probably more work at the Crown Point wildfire, which was quite a big endeavor that was managed by the state of North Carolina Wildlife. But appreciate all the firefighters that came out to help with that. I understand that down in Brunswick County, they also have large out-of-control fires and could use some help down there, just like we did up here. Was able to see what is near complete, the new playground at Hines Farm Park. I encourage you to drive by. It's not ready for use by the public yet, but in the coming weeks, there'll be a grand opening there, and a very nice new playground for our citizens will be in service. And then I do want to thank Chrissy for the excellent community health needs assessment presentation. One of the things that we committed to in that plan is to train all of our employees on mental health first aid in the coming 12 months. So that's one way we are going to be addressing health deficiencies in our community by training 1,400 people in how to help folks dealing with a mental health crisis. Thank you very much, Mr. Chairman.
Thank you, Mr. Smitherman. Time for commissioner comments. Who would like to go first? Any volunteers?
I'll do it.
All right, Commissioner Davis.
First, I'm going to echo the manager for the fire response to the Crown Point Fire, Hubert Fire, volunteers from municipalities, Carteret County. I even saw everybody gets excited when the Carteret County Woods truck comes across because it brings little old school memories. So, but just an excellent by our folks as well as all the supporting departments. So huge thank you out to everybody on that. And if you've kept up with the Facebook posts, the community, I don't think I saw any negative posts. The community was very grateful and thankful for how that was handled. So thank you. And you were able to avoid an evacuation, which I think meant a lot to people as well. So thank you. And volunteers, just extra, I see several of you guys out here. Thank you for what y'all do. Big supporter of you guys. I grew up around volunteer. My dad was a chief for a long time. So I have a different perspective in some of the meetings that we have. I drive these guys crazy, but that's okay. But really appreciate what y'all do as volunteers and the sacrifices that you guys make. Mr. Glenn, thank you for being like the traditional mechanic. I bring my phone to you and say it's broken, and then you touch it and it works. You know, it's like taking your car to the mechanic. So when it fails again, I'll call you again. Well, that's all I know to do, but thank you. And then, Mr. Spencer, are you still here? Just thank you for sharing your story. I don't know what we can do about it or what the sheriff will be able to do. I know a lot of that falls under the North Carolina Department of Motor Vehicles, but just you sharing your heart with us and that situation just brings out the seriousness of what you're discussing, so thank you for that. And I think the shooting range folks have left, so I'll hold my comments for that. So thank you, Mr. Chairman.
Thank you, Commissioner Davis. Next. Anybody?
I'll go.
I'll take it, yeah. I would draw your attention to the consent agenda today. We just appointed a whole bunch of people to some boards and commissions, and we really appreciate the service of our citizens. We try to be everywhere at all times, but we can't do that. So our boards and commissions are our representatives to the community. And also the surplus property that we sold in today's consent agenda. I appreciate the staff who are constantly looking at what the county owns that we don't need. And let's get it off the books and get it back into the taxpayers' hands. I need to thank our EMS, our county emergency services, for the AED and Narcan training that I was able to take in the last about 2 weeks ago. It was a very good program, and if you haven't seen the race car program, they're available to teach your group or your club or whatever how to do hands-only CPR and administer Narcan if that becomes necessary. And I need to thank Onslow County Schools and the Eastern Regional Skills Center and John Shannon for allowing the Salvation Army to have a great fundraiser on Saturday at the Skills Center. We brought a lot of people into the Skills Center that didn't know that we have in Onslow County a trade school for our high school students where they can learn many different trades, and I think that's a great thing for Onslow County. So that's all I've got. Thank you. Have a good day.
Thank you, Mr. Bennett. Mr. Carpenter?
Yeah. Along with Mr. Fretwell, I too am a little jet lagged. I flew through a variety of airports in the last few days, and I just want to do a shout out to Mitch and his gang out at OAJ for having the cleanest airport in the state. Like for me, Minneapolis, Las Vegas, Atlanta. I would rather be in our airport all day long than any of those. Also wanted to thank Mr. Spencer for the words that you shared today. I'm truly sorry that you experienced what you did. And I don't know what the solution is with that either, but I do think that we're in a position where we can at least share with the proper authorities, hearing from you and others in our county, which I know you're not the only one, see what we can move along, in a higher level. Thank you so much for everyone that was at our workshop this morning and participated and presented. That was a very lively discussion. And Stephanie Kane, I just want to let you know, if you're still here, I don't see where she is, but I think she left early, our new EMS director. It was very, very insightful to hear what has been done with the study that we recently had done with the county to assess that department, and I think we're making great strides, and I just really appreciate all the staff that are moving forward with those things, because I think that will greatly impact our citizens' well-being and health. So thank you so much for that, and have a great day.
Thank you, Mr. Carpenter. Mr. Paget?
I just want to say thank you for everyone that's here and for our presentations, and echo what's already been said. We live in a great place, and I'm proud of each and every one of you. And thank you, and have a good day.
Thank you, sir. Mr. Buchanan?
Thank you. Appreciate everybody being here, and everything's been pretty much said a while ago. About 2 weeks ago, Lisa and I attended the Vietnam Memorial. I was awarded the Vietnam Memorial Medallion, which was really an honor for me. Myself and the speaker were both Vietnam vets, so they gave us this award, which was really nice. I want to thank everybody for being here.
Thank you, Mr. Buchanan. Vice Chairman?
Thank you, Chairman. I missed the last meeting. It's good to be back home. I was in Nashville with my wife. I guess the highlight of that conference that she went to, she got to meet Attorney General Pam Bondi that spoke at her conference. And I'll tell you what, Attorney General Bondi is, she's a remarkable person. She's catching a lot of flack for what she's doing, but I applaud the Attorney General Bondi and the whole group. It was high security there in Nashville. Nashville's a nice town. I've seen it, and that's it. I don't want to go back, but it is a beautiful town, and just trying to get back in the swing of things. I want to thank everybody for the workshop, and thank you folks for coming out today and speaking. I really appreciate it. I took some notes. I was listening, and I hope you guys have a wonderful week. Thank you.
Thank you, Vice Chairman. I think everything's pretty well covered this morning. Just thank everyone for being out here. Mr. Spencer, appreciate you coming and asking a question about coming out and speaking and bringing that to the public's attention, because I think there's probably more than just you that bothers and that has an impact on it. Thank you for your service. We appreciate that. And I know that we're doing everything we can to figure out how we can maneuver noise and everything that's taking place as things continue to seem to pop up. I know Mr. Bogey didn't speak this morning, but he's here religiously, and we understand those concerns as well, and we're always trying to figure out what we can do to help you, and we're not going to give up on that. And we appreciate seeing folks from fire stations, I believe. Is everybody from Back Swamp? We got a little bit of everybody, Richlands, and so we appreciate you being here, and pay attention to your volunteer fire departments when they put those advertisements up by the road. There's always a great Saturday to go out and get some chicken and barbecue, and I will say Back Swamp does the best fried chicken there. So we appreciate everything that you do because you're constantly on the move, and I do believe this is quite far the worst beginning of a fire season, lack of a better term, that we've probably faced in 20 years or so. So pay attention to burn bans, pay attention to what you're doing out there in the public, and let's help keep our firefighters safe to where they don't have to go deal with our inability to follow directions and good protocols. With that being said, we're going to adjourn and go into a closed session, and we will
Motion to go
not
into
be
closed
back.
session?
Second.
And there we are, motion and a second, discussion. None, all in favor signify by saying aye. Aye.